This is Dr. Richard Fleming, and today is the 16th of August, 2020. I just read an article in the New York Times talking about how COVID is sending some people's bodies to war with themselves. They're almost on target. They're talking about something called cytokine release syndrome, and I realize that that's the term that's come up in the last 10 to 15 years to explain an immune response in the body that results from our using chemotherapy to target certain types of T cells and other cells in our body, primarily for the treatment of cancers. The people that are dying with COVID-19 are dying because once they're infected, their immune response, the inflammation, the swelling, and the blood clotting that occurs as the body tries to attack and kill this virus isn't being controlled by the body. It's run amok. We've talked about this before. Reading this story in the New York Times is really disheartening. It's disheartening because it shows that people are beginning to pay attention, but they still don't have a clue entirely what they're talking about. They still don't recognize that it's been talked about for 26 years. And they don't have a clue that they should be paying attention to this problem, not just with this virus, but with every infection going on. It's one thing not to be listened to. It's another thing to watch the entire planet go into chaos as a result. I can't go to stores or walk down the street without seeing the antagonism between people about wearing masks or which treatments to take or vaccines related to COVID-19. This has effectively pitted almost everyone against everybody else, half and half. The civilized conversations that used to be held, the efforts to have a scientific discussion about what needs to be done, the ability to really look at what's causing the problem and treat that versus just knee-jerk reflex responses has all gone by the wayside. And the publication of this article only reinforces for me that nobody really appreciates what's going on, because the article speaks as if this is some new revelation that has occurred after hundreds of thousands of deaths. It's a new revelation if you don't wish to listen to what's been told to you before, but I have repeatedly said, and I will say it again, it is the response of the immune system to a virus in individuals whose immune system is not well controlled that causes an inflammatory swelling and blood clotting phenomenon that has killed hundreds of thousands of people. It is not because we are passing this virus to one another in the streets, or that we've been inadequately social distancing or not wearing masks. Soon they're going to try to get everybody to take a vaccine, and that is only designed to shorten the amount of time it takes your body to react to the virus. It does not eliminate the virus, and it does not eliminate this reaction to the virus that is killing people. I do feel like I'm speaking to concrete. I feel like I'm talking to students that aren't capable of listening. And I feel like I'm talking to politicians who aren't interested in taking care of people, and in journalists who only want to sell their side of the story instead of being right about the story. The sense of frustration that I have over watching people die, over watching societies be shut down, over watching people become antagonistic and at war and angry with each other. If my frustration shows, trust me, it's not the full extent of my frustration. Please listen to what I'm telling you. There are treatments for every part of this immune reaction. And if you don't pay attention, if you don't listen to what I'm trying to tell you, there will be hundreds of thousands of more dead people. There's even groups of people out there that want to pretend that these viruses don't exist, that somehow it's just exosomes and terrain theory. These people are either selling you something or on something, but they're not even close to helping you. The reasons why the hospitals get overwhelmed is because when people come in and they are sick and they are not treating the underlying problem, the inflammation and the swelling and the blood clotting, those patients will not get better. You will not get them off the ventilator. To relish in one person being discharged after months shows how poorly the treatment is going for these people. Please pay attention. Please address the acute T-cell cytotoxic response occurring in the first few days of this infection and the adaptive humoral antibody response occurring in the 7 to 8 days. If you do not address these, if you do not address the complement cascade going on with this, and the physicians are the ones who understand what I'm talking about when I say this, if you do not address these things, you will be lucky if people survive. Hundreds of thousands of dead people throughout the world have shown that the consistent approach to ignoring this information results in dead people. Dead people who have families and loved ones and friends and colleagues that will never see them again. Dead people who didn't even have their friends and family there with them when they died, because we have run amok and we have not practiced medicine. We have practiced panic. We have not practiced knowledge. We have practiced fear. We have not been in this together. We have been this against each other. Please, I beg of you, stop ignoring the message. Please pay attention to the inflammation and the swelling and the blood clotting killing these people.